Stephanie Hall and I use she/her pronouns. I'm a sexual well-being student coordinator at Health Education and Promotion at UC Davis.
Hi, my name's Abby Ye. I use she/they pronouns, and I'm also a sexual well-being student coordinator at HEP.
This video has been designed for student health and counseling services providers and their use of language in a clinical setting. However, UC Davis feels that these are good guidelines for all healthcare providers to use.
Why is language important in healthcare settings? Studies have shown that language and communication can influence a patient's overall trust in their provider and the overall healthcare system, while also impacting their health outcomes. In this video, we'll explore ways to enhance language in healthcare settings to make it more inclusive, trauma-informed, and student-centered.
Health literacy. Throughout the visit, providers should use language that students can understand to improve their health literacy. It's recommended that we use different approaches to explain information by providing students with written instructions, images, and videos. Confirming a patient's understanding of medical advice or instruction is an important step. Providers can do so by periodically pausing and asking questions similar to the following. Would you like me to repeat or explain something a little bit more? This style of communication ensures comprehension without testing or shaming the student.
Trauma-informed care. Many people have experienced some form of trauma, especially those from communities that experience marginalization, and we must always respond with empathy and compassion. That can look like asking trans patients what names they use to describe their body parts and mirroring their language. Respect the patient's decision to decline to answer a question. You can also be sure to explain why a certain exam is recommended and let the patient know during any exams that they can be stopped at any time.
Militaristic language. We should strive to create an environment where patients feel encouraged to be actively involved in their healthcare and ask questions. Using militaristic language to describe patients or their conditions can be harmful as it may negatively influence their decision to continue or discontinue care, as well as their ability to recover from an illness. While some patients might feel empowered by language around fighting an illness, other patients may feel shame or stress for believing they are not fighting hard enough. Consider speaking to your team about better alternatives and how to avoid using violent metaphors to describe patients' illnesses. One option is to simply avoid using metaphors altogether and be clear about what's actually happened. For example, instead of saying someone lost their battle with AIDS, you could say someone died from AIDS-related complications.
Privacy and confidentiality. Privacy concerns are a documented barrier to accessing healthcare, not just among students, but anyone. If a student is an insurance dependent and wants to keep their healthcare information private, they may complete a confidential communications request form by contacting their insurance provider. This will ensure that the statement of benefits and other insurance information are sent to the individual who received services instead of the policy holder. More information can be found on the SHCS website under Navigating Privacy and Confidentiality in Healthcare.
Sexual orientation and gender identity. It is important to avoid making assumptions about a patient's gender identity, sexual orientation, and lived experiences based on their actual and perceived identities. Creating a welcoming and inclusive environment can start with a simple greeting that includes your name and pronouns. If a patient's pronouns are not present in their records, it is okay to ask the patient for their pronouns and the name they want to be called. Make sure to document this in the electronic health record to avoid them being misgendered or dead named in the future. It is best practice to ask first in case they are not out elsewhere or their parents have access to their Health eMessage account.
Students also have the option to update their lived name and gender identity on several university systems, and they may need guidance to navigate those changes. If so, they can reach out to the trans advocacy specialist at the LGBTQIA+ Resource Center. You can refer to SHCS guidelines for the quality care of trans patients on the staff website for more tips and resources.
Ask for feedback. Finally, asking for feedback from students at the end of their visit is an excellent way to better understand what works for them and what doesn't. It is crucial that we listen to student perspectives and experiences to improve our services, and it only takes one negative encounter for a patient to never want to access the healthcare system again.
Thank you for watching this video that was created by student coordinators at Health Education and Promotion. Remember that we are always here to offer support by identifying needs, improving access, and developing new resources or educational materials. You can find all of our printed resources at the link below.